Okay, so the topic is art as medicine, the use of creativity for healing in psychiatry. So I'm your creative host, Kayse Budd, and I wanted to just take a minute to, I can't decide if I want to sit or stand, to talk about, I'll stand, why this topic was the perfect one for me. Many of you know me, and I'm really creative as a person, and that started back in childhood. And then in high school, I studied art, kind of semi-seriously, I guess you might say. I showed some pieces in local shows, and I won the most outstanding senior art award in my school, which was a big public high school, and that was quite an honor. But then in college, I decided to be pre-med, so I went into medicine, but I was still really interested in why people made art. I just thought it was so fascinating. It always was such a joy to me. So I took an art history class, and that turned into like 10 art history classes, and then I had an art history minor. And for my senior project in my art history minor, I created an art therapy program for cancer patients at Duke, which was where I was in college. And this was just an idea because I wanted to do something creative within my parameters for the project, and I'd never done art therapy before with anyone else. You know, I sort of just made it up based on abstract expressionism and what I knew about what was going on in art history. So I just proposed this program to the Ronald McDonald House, created it, got funding, ran it myself for 6 weeks. It was an amazing experience, and you know, of course, I got an A in the class, but then I went on to med school, and I was so enthusiastic about art therapy. I founded a program at Michigan in the Children's Hospital there, also in art therapy. I called it Art Outreach. And I got a bunch of medical students to help me, and we got funding, and we sort of made a big deal with this one. And it was just a wonderful experience, and it really set the stage for me using creativity for the rest of my healing work with people. And some of you might know that Dr. Weiss, Dr. Gilbert, and I have done the mind-body skills training. So this was sort of what I saw as the next step. After medical school, I did this training in mind-body skills, and then I took what I learned from the Center for Mind-Body Medicine and doing mind-body skills groups. I put in what I already knew about art therapy and movement therapy, which I'd been studying on my own, and yoga, because I'd become a certified yoga instructor. And so I put all this together and started making my own brand of creative healing. So that's a little background. So I'm going to put some art throughout just to illustrate my points. So I drew this on Sunday as I was really trying to get everything put together and move from the kind of linear world of all the research I was doing into the sort of visual world of what I was really trying to express. So I thought the best way to demonstrate that creativity is healing is for us to do a little experiment. So that's what the oil pastels and cups are. So if everybody can just find a cup of oil pastels that's near you and a piece of paper with the circles on it. I take one of each. And there are some Kleenex scattered throughout in case you get oil pastels on your hands and you want to clean up. Okay. Does everybody have what they need? Anybody need anything? Okay. So what we have is a page. I want you to divide it into 3 quadrants representing past, present, and future. You're going to have 3 minutes for each quadrant, and I'm going to time you and just let you know when to move on to the next quadrant. So using your non-dominant hand, just go with whatever colors that you have that inspire you and proceed with the exercise. Past, present, future, 3 minutes each. Okay? So start. So now just take a moment and look at what you've drawn. And it may even be helpful to hold it out in front of you. A lot of times if we have space to do something like this, we might step back away from it. So just kind of hold it away from you so you can get a more of a far away perspective on what you've done. And then just make some impressions for yourself. Just note, what did I draw? What came to me? And what is that trying to say? Or why would I draw that? And just sort of look at the past, present, and future, and look at why you chose to draw what you did and what came through. Look at the quality of the lines. Were your lines more angular and rough, or did you draw smooth shapes? Did you draw circles? Did you draw more shapes, or did you draw actual images of things, words? Were you inside the lines, outside of the lines? Did you do past, present, future just like that? The whole way that you use the page can help just inform you about your process and how you approach this task and how you approach other tasks, perhaps. So, just noting patterns of color, the overall energy. Is it positive? Is it negative? Sad? Do you feel relieved from doing it? Is there anything different at all about your energy from having done that? So that's the kind of end. How do you feel after doing that?
I have a question.
Yes.
That may not be an answer, but